It's great to be here. And it's great to be here because I was here last year, and when I came back home, I said, this was cool. So I attend a lot of conferences, and a lot of them are informative. This one was obviously informative, but it was also fun. It was cool, and that made it rewarding. That made me want to come back here, and that's really what I want to talk about today. What makes us want to revisit? What makes us want to adhere with anything, be it medication or digital apps designated to help us maintain our health? And I want to make the point that, yes, some of it is about it's important, some of it is about it's interesting, and some of it is about we're humans and we want to be engaged, and if you engage us and motivate us, you're going to get quite a lot out of us. So patients don't adhere to medication. We all know that. And it's very easy to point fingers at them and say, well, why aren't they doing this? Let's try and think what makes us, what makes you, what makes me adhere or stick with anything digital. So not really always knowing that it's important, if we're completely honest. I mean, a lot of us would play Angry Birds and none of us would claim that it's important. What it is, though, is it's fun. There's an immediate sense of reward, an immediate sense of accomplishment. And if you look at people who are runners, they swear by their runner's log. They don't want to go for a run without their runner's log. How cool would that be if that translated to the health domain? Guess what? It doesn't. These are the figures for adherence to medication coming from Ph.D. at Wharton. And this is secondary non-adherence. So the numbers you see here are for people who filled their first prescription. I'm going to be showing you numbers for people who have not filled their first prescription in a second. And numbers keep dropping. After 6 months, it's about 50% of the patients who are still adhering. And if you look at it here, the green bars are the ones you don't want to see. The one on the top are patients who never picked up their first prescription. The one at the bottom are patients who have picked up their first prescription but haven't really followed through, and those who never did. So essentially, you see the gap between prescriptions that could have been filled and weren't. Why, oh why? Why is that happening? It's obviously of great interest, and a researcher at Merck did work on this, and what they found out is there are basically 3 reasons. The one at the bottom is affordability. I'm not going to touch upon. The others are knowledge. Do people know what the medication is for? Do they realize what its side effects are? Do they know what the disease is? Are they even motivated to treat it? Do they think it's important? Do they think it's curable? If they have the knowledge and they have the motivation, and setting cost aside, they are much more likely to adhere. So you need the knowledge about doing the right thing. What is the right thing? Do patients get it? And I want to challenge ourselves and ask, are they supposed to? Let's look at this slide from the website of DNA Direct. That's a direct-to-consumer genetics company. I did some work with them. The lady in the picture, looking utterly perplexed, is the founder of the company. When I look at her, and I look at the picture, and I look at the really long words out there, the message it's sending out to me is, this is really complicated, Talya, you're not going to get it. This lady here advertises depression. And I love this slide, and I swear to God, the only manipulation I did in the slide is I highlighted in red the part which I think is ludicrous. I mean, the exact way Cymbalta works in people is unknown. What does that tell me? That tells me you're not going to get it. It's not for you. Guess what? There's information out there. It's for the really smart ones. If you're a patient, I don't know. I'm not really sure. Another great anecdote, which is also probably pretty sad, came from a health literacy webinar where a patient said, well, I was prescribed beta blockers, but I don't know what betas are and why I should be blocking them, so I never really took them. Yeah. This is a screenshot from a great app for medication, but I think some people would claim that there's information overload. There's a bit too much going on the screen. It's hard to figure out what the action items are. Where do I go next? And if you're going to tell me it's self-explanatory, I'm going to say, to whom? It might be self-explanatory to you, but it may not be self-explanatory to 90 million Americans who have low health literacy. They read at a reading level of a 6th grader and below. And if you don't understand, you're not motivated. And I want to say, it's not just the great unwashed who don't get it, it is also moi, because whenever I check into the Empire Hotel in New York City, which is really cool, something happens to me that I'm sure does not happen in Mr. Rosen's hotels. It's very hard to turn on the hot water faucet. I never find the button. I always have to get someone to explain it to me, and I've heard people complain to the reception that they ended up washing in the sink. So it's not always self-explanatory, and if it isn't, someone is not going to adhere with your medication, with the medical device, or in fact, with whatever it is we're selling them. Sometimes we know and we have the information. So why is Penelope Cruz smoking? Obviously, she knows it's bad for her. I guess it's kind of fun. It's immediately rewarding. So if we want health to be followed up on, we have to make it fun, and we have to make it immediately rewarding. How does that happen? A great app developed by Margie Morris, and she actually presented it here last year, is for anger management and mood management. And when you use it, you take a deep breath, and immediately, this feels great, and you revisit the app. Why? Because you were angry before and relieved after, and this is something that gives you instant gratification. Other modalities reward you for offline behavior, such as exercise, or even for the real deal, which is taking your medication. So yes, swallowing a pill may not be great, but if you're rewarded for it, there's some form of an incentive, some sense of accomplishment, and you might be more likely to follow up. I think it's really cool when you can combine the knowledge with the motivation. And I'm doing a project with an Israeli HMO, which we actually have a representative from right here. Israeli HMOs know everything about you. They've had EHRs for decades. And what we do is we're touching 150,000 patients on statins, all of whom access their EHRs from home. And we're giving them information on their statin adherence, and we're motivating them. How much of a difference is that going to make? I don't know, but guess what? Even if we move the needle by 10%, 15%, it probably costs the HMO maybe 2 days worth of programming. I think that's something very worth pursuing. Something else I'm super excited about, if you were in New York Monday and Tuesday, the UN Assembly was discussing non-communicable diseases. And they were also discussing this, the suggestion for a health scorecard. Something to present people, a way to present people with information on their health, very short, the main causes for chronic disease and mortality, and hopefully phrased in a way that's actionable, that's clear to everyone, and summarized in one number. That's all. 7 is perfect health, 0 is pretty much horrible. And you know where you stand. If you're a 4, you want to be a 5, and the language there also motivates you. So again, there's the knowledge and there's the motivation. And the next component, which I think is really cool, and Kevin mentioned, is personalization. Why is there a cow here? Do you know? It's because when a cow, I hope, is there anyone named Sarah here? No, great. If a cow is called Sarah, she has a name, she is going to produce 4% more milk than a cow that just has a number. How about that? That's many, many gallons of milk a year. So we're not cows, but we also like to be treated in a personalized manner. I'm going to skip this. But even with HIV patients who really need to take their medication, they don't just do it because it's important. They are more likely to do this if they feel that their doctor knows them as a person. If a doctor touches your hand, if a doctor knows who you are, knows something about you, you will be more adherent and you will have better health outcomes. And indeed, Vic Stretcher presented this last year with wonderful smoking cessation interventions, all of which are automated. And this is the kind of technology I'm using at my company because I think this has to be scalable. It has to have scale. We want to be treated as people, but it's very hard to get someone to do that for us on a large scale. So if you tailor interventions, you can increase smoking cessation rates from 28% to 38% using 3 pieces of information the person just gave you about themselves. And you need to address what really hurts the patient. And I want to give you an example from a study I did on the FDA warning on cough and cold medication. Some parents were adherent and some were not. about 53% of new parents were adherent. They don't have a lot of experience, so when the FDA says this is dangerous, they believe the FDA. But the experienced parents who've already raised the child beyond the critical age of 2, they've given their kid cough and cold medication a ton of times. Nothing bad happened. In comes the warning, they are not convinced. I did what I thought was idiotic. I emailed the FDA asking them, did you target, did you segment your message? They actually emailed back and they said, no, we just send our message out for everyone. Well, guess what? You're not being incredibly motivating. You're not even being the least bit personalizing your message when you don't know what hurts your patients. How do you do that? You ask. You create the technology that combines artificial intelligence with decision logarithms. And you allow people to pour in their information in ways that are clear and simple and give them feedback based on what they have just told you. And then you can understand what is bothering them. And if you can understand that, you can target it next time you're contacting them. We're starting to, I'll go back a second. We're starting to do that now with a wonderful diabetes application that people have been using for years. But still, the app developers have great technology, which will often be the case, and they're not really sure what makes people tick. So this is what we're trying to do now, to help the diabetics understand what's going on in their lives, reach a decision to be of better glycemic control, and tell us what's important to you, what is helping you, and then help them follow up on that with interventions. What we do is at Cure My Way is what probably a lot of you are doing, and I want to share with you some of the lessons we're learning as we go along. One is to ensure comprehension. Nothing is self-explanatory. Don't take anything for granted. Increase motivation. Find ways to do that through rewards, and rewards can be virtual. They can be points. They can be tiers on an imaginary game that you will never get anything tangible out of, but you will feel that you're accomplishing something, and you will want to get there. Personalize. Talk to people. Use their name, but really go beyond that. Address whatever's hurting them. That's meaningful. And if you do that, they will go along. Explore what it is they're seeking. Allow them to give you feedback, not just in the comments line, which I never believe anyone reads, but actually ask them and engage them, because if they're engaged, they're motivated and they will go along. And just like adherence interventions, the good ones are complex. They would have to integrate the knowledge, they would have to integrate the motivation, the personalization, the cognitive side, but definitely also the emotional side, because after all, we're people. And the reason why I came here today, and I got here at midnight, but I really wanted to be here, was because yes, this was going to be interesting, and yes, this was going to be inspiring, but it was going to be fun. It was going to be cool. It was going to be a great experience, and that was something for me which was worth pursuing. And if we can convey that to healthcare, to digital, mobile health, I think we're going to find ourselves really helping patients and making a difference. So I'd like to thank you, and I would love to hear questions, comments. I'm going to be here all day. Thank you.